Welcome to Occult Awareness for conditions that is rare, newly discovered, underfunded, and we are here to raise awareness, bring invisibility to the light, and help us together in this change-making community. And today we have Arlen here to talk about her story and a lot of insights into the health system and her good and bad experience, I guess. So yeah, welcome.
Thank you. Thank you for having me.
Yeah. So I will start with a little bit of visual description because I know some people might listening to it and not really know what we look like, or or some people who have visual um impairment. And so I'm just gonna start. I am an Asian woman and I have a short buzz cut. Um, and I do have my pink headphone on. I also wear a blouses today, with a little bit decoration on the side of the collar. And I also have my microphone on the left and my mouthpiece on the right. I'm in a power wheelchair, and I have basically in my apartment. My background is literally a whole entire classical music like map timeline. Very cool. So yeah, um, I think I'm finished. And if you wanna carry on.
Uh, well, uh, I don't even know how to describe how I look, but I'm using a cervical collar that is decorated uh, with uh, metallic shiny things, and I have an orange shirt with a zebra, and living room. All you can see is a really big window with a lot of light. Uh, yeah, that's
Okay, yeah, great. Thank you. And then we can start maybe with your um start of your journey, where when you had your symptoms, and how did you get diagnosed with your genetic conditions, and um how things kind of developed.
um, well, symptoms. I started having symptoms since I was born. Um, GI symptoms, infections. I was supposed to be clumsy. I had um, muscle weakness that started getting worse when I got an infection when I was 5. And I developed really bad fatigue after that, and it never went away. It just got worse. Every infection, every injury made me worse. Uh, I had like it was progressing with time, but we had no idea what was happening. I was never able to do any kind of physical activity, or not even going to school normally. I was missing 60, maybe 70% of every year. So they had to make like meetings to see, oh, can she pass to the next grade, because she's never coming. Uh,
Yeah.
I was able to pass because I have really good like uh, I was succeeding on the intellectual stuff, but I was not there. I was not the absenteeism was really bad. Um, when I got an infection when I
Yeah.
was 24. Um, wait, I already had intermittent paralysis. Like it will last from a few minutes to hours to 2 hours, but my mom just let me over the bed and tell me just rest. You have a lot of pain. It's gonna pass. I had pain coming all over my spine to my legs, and I was too weak. I couldn't stand or move. But after resting, you will get better. And I was walking normally again. So we never know what was truly going on, but I was uh, every day slower, every day having more clumsiness, and every day walking less and having um, more GI symptoms, more um, even brain fog, but we didn't know the name. A lot of infections and GI issues. And there was never an explanation. She's just gonna get better next year. Next year, this treatment is gonna make her better. The GI issues really stopped me from doing most things, and I was never able to do physical exercise. So, with infections, every infection after after 15, they started to increase my muscle weakness in my legs, in my arms, in my hands. And the episodes will last more. Well, it was not every day, so we had no idea what was happening. And the answer from the doctor was always, oh, it's just fatigue. It's just fatigue. She just have it's pain because she has electrolytes abnormalities. She's just like she needs electrolytes, and that's it. And it was never clear until I got cytomegalovirus and became chronic. So I started having episodes of the virus every month. I had the virus since I was a kid, but then they did blood tests and it showed that it was chronic. I was having the virus very often every month. So then I had like a flare, and from one day to the other, I was living in the fourth floor without elevator, and I was tired every time using the stairs, but I was able to do it. I went to sleep and I woke up like feeling really bad, and I was like, "Oh my god, I have like a flu or something's bad." I wasn't able to walk down the stairs, and I was, "What's going on here?" But I'm very very skinny, so it was easy to carry me. And oh, maybe you're feeling bad right now, you get the fever down, you're gonna feel better. That was in the morning. We spent all day outside, and we came back at night. I was unable to use the stairs. Like I was walking, but very weak, and I was unable to use the stairs anymore. And after that, uh, I I had like days when I was stronger, but I was never able to do it normally anymore. So I needed help. I needed crutches. I needed to use something with the stairs because I was unable to do it standing with my legs. I um, like a year after that, I had another infection called Zika from mosquito bite.
Yeah.
And the infection was really bad. I got a rash all over my skin. All my body was red. And I started having not only leg paralysis, but my whole body was paralyzed from a minute to the other. Like I was unable to move my face, my arms, my hands, everything. And uh, the first day we got really scared, but we say, well, let's wait tomorrow to see it is the fever, if you're having seizures, or something that's going to pass. But no, it became chronic every day, every few hours. I will have another attack. We went to the hospital, and I got inpatient for about 2 weeks. I had a lot of testing. They did found like test results that were wrong, but nothing will give an answer on what was happening. They had no idea, and they started asking for symptoms that I had since I was a baby, like neurogenic bladder, for example. They started asking, "Do you have any time? Do you have a urinary urgency, urinary continence?" And I was like, "Yes, every day." It's the normal thing for me. I was so they discharged me because they had no idea what was going on. But the report was really good, explaining how the weakness was happening, and that they say, "We know something's wrong here, something neurologic, something's happening, but we don't know what's happening. You need like a bigger hospital or something to see if they can find if it's genetic, because there are so many symptoms that are not new, that then these one are getting worse." I went out of the hospital with a wheelchair, thinking that it was temporary, but it was not. I went home, in a few days after that. We were calling doctors, everyone sending the reports, everything, and they had no idea. No one has any idea that maybe she needs to go to another city or something. And I don't know why I said, let me try to, I come from Venezuela, so we speak Spanish. And I say, let me try to Google like 5 of my million symptoms in English. Maybe I find something. I mean, Google has a lot of information. I don't know why I never find things in Spanish, but maybe let's put 5 words in English. It was 10 p.m. and I found Ehlers-Danlos Syndrome. And it was like reading my whole story. And I remember that when I was 10 years old, I was 30 at this point. But when I was 10, I went to the doctor because I was having at least 3 injuries at the same time and doing nothing, just by walking to the bathroom or like, it has no sense. And the doctor said, she has Ehlers-Danlos. That's why she's so flexible and she's going to have injuries, but she should work at the Cirque du Soleil because she can become millionaire if she do that. And my mom told him, "But she's very sick all the time and she gets injured just by going to the bathroom. How is she going to work in the circus?" That's great. But we never took it seriously until I read that in English. When I read that, so Ehlers-Danlos is connected to this, and I was like finding 10 conditions at least, and I had the symptoms of each one of them: POTS, mast cell, CCI, cervical instability. And I was like, there's no chance I can have so many diseases, and no one knew I had all of these. But they are even saying the same words, like the same complaints I have with the doctors. It's here. I went to a cardiologist to check for POTS, and he said it's too obvious. I don't know why you never got diagnosed before. If you had the symptoms, you were a kid. And Ehlers-Danlos, of course. Why didn't you have a diagnosis? And I was like, I don't know. Ask the doctors. After that, we realized there were no doctors in the whole country to do anything. I tried going to Argentina by myself in a wheelchair to see if I could find any treatment, and they found really bad gastroparesis and tried to put a feeding tube. It made me so much sicker. My legs became weaker, which it seems it has no relationship but something with blood flow or something, because the tube in my abdomen made me so weak, and it never worked.
Mm.
They were doing more testing, but nothing was pointing on my symptoms. Why is it that I cannot stay up? Why is it that I cannot sit down? Sitting down is kind of, I don't know, it's too weird not being able to sit down.
Yeah.
And they have no idea. I say, no, I'm leaving this country. It has no sense to keep trying here because they are not finding anything. I then went back to Venezuela, went to Colombia
Mm.
a few months after that, and I met like the main geneticist in the country is the president of the genetic like the biggest geneticist of the whole country is her. She met me. She said, I've never had a patient with Ehlers-Danlos Syndrome, but I know what is it. I'm going to read all of this, and let's have another appointment next week. And I'm going to check your medical records, and we will see what to do. And she said, she gave me this report saying she has just too many comorbidities, it's too complex. It's a really severe case of Ehlers-Danlos, and we don't have any doctor that specialize in this. We don't have any machine to even test her for any of her conditions. We can only do blood tests, and that will never show a lot of dose that she needs to like to evaluate her spinal cord, the neurological symptoms, and there's a lot of things that she needs to go to the United States. I was so choked. Like, it was like I went just to one appointment. That was all. But she was really kind, and she says it's not ethical to tell you that I want to try, and I'm gonna start ordering testing that I know they had no relationship with your symptoms, and I'm seeing you, and then it's cruel not to tell you where you really need to go
Mhm.
if I know. And so I filed, I got a visa, and I came to the United States thinking that it was this year still. Like, yeah, I go to the doctor, they find the stuff, they give me whatever pills I need, maybe a surgery, maybe something.
Mm.
It became so complex, like that I started finding one disease after the other, like everything I was being tested for, it would come back positive. Like gastroparesis, spots,
Yeah.
mast cells, primary immunodeficiency. Um, then it's not just gastroparesis, over bowel dyssynergia, ergenic bladder, CCI, tetracore, and then vascular compressions. Um, there's more, but those are like the main.
Yeah.
I didn't have insurance at the time, and no one explained to me that how the system works here.
Yeah.
Without insurance, you will just be discharged home. I was discharged so many times, vomiting blood, like
Yeah.
liters of blood. I wouldn't know what's
Oh.
going on. Just like some vomit. I
Mm.
was like, are you crazy? It's liters of blood. They will send me home.
Yeah.
And um,
You already
I
went
think,
to you already went to the doctors that you thought that here that can help you, right? So that means like you have specific doctor that already specialized in knowing EDS.
no, yes. No, yes. I first went to the to Dr. To in New York, Dr. Bolognese, and they never take case that doesn't have an insurance. They just don't. They even email me that they don't. And that's it. And it's just a lot of money. And what they found really severe instability with they did this test was amazing, really painful, but amazing. The invasive cervical traction test.
Yeah.
But the test is better than just the upright. It's way better what they find, and it's like better. But I didn't had the surgery. They sent me to have mild surgery, uh, and I once I got to the hospital to get mild surgery because that was, let's say, covered as an emergency. That was something a little weird, and doctor never charged me. And the even the nurses say, "Oh, but all the patients with instability get the instability corrected first before mouths." Everyone, and
No,
I was so
not me.
shocked. Yes, but they told me that, and I was like, "Well, I don't know." They sent me here in everyone's, and uh, well, for me, I was saying that this is mouse is not causing my GI symptoms. They come either both from my lower belly and from my neck because you take away my colon and I start vomiting even without eating. So
Mhm.
it's pretty much related to
Mhm.
with that. It's really bad. And then I got to see Petra Klinge, and she diagnosed me with tether cord. Um, but she said that without without insurance, I was unable also to have the surgery. And she she made me go back, like 10 months later, and
Mhm.
made a longer, like more testing, more evaluations, and she said I need a 24/7 a 24/7 caregiver to have, like, she interviewed, she made a lot of physical testing and clinical and read all of my medical records. I don't know how, but she really did. And she said, I consider that you cannot have any surgery without having this. Family, it has to be a family member because no one's going to be a 24/7 caregiver. And unless you pay for that.
Mhm.
And then, um, but I was alone. My mom is in another country. She doesn't have
Mhm.
a visa. And um, we tried to bring my mom. It was just really hard. Petra will always be trying to ask me what's happening. Did you have any other testing? Like
Yeah.
being aware of what's going on. She also speak with my geneticist, was Claire. I jumped from Claire. She was the first doctor who actually connected the dots.
Yeah.
This is the biggest of things because she said in 5 minutes, you have this, and you need at least 2 surgeries. And I was like, you know that in 5 minutes. And she said, yes, we need to test you, but I know.
Yeah.
And well, we have no chance to bring my mom, but Petra will keep speaking with Claire, speaking with me, and making sure how my symptoms were progressing. And when she say I needed for 24/7 caregiver, she say I had no medical hope or having any improvement on
Yeah.
bladder, on neurogenic bladder or neurogenic bowel symptoms, that the
Yeah.
damage was too severe too. critique in any improvement. Like from the surgery, she say you can have less pain, less muscle weakness, and maybe walk, uh, but nothing else. After we spent like a year trying to bring my mom, as it's been really hard to get the visa for her. Yeah. And she had a lot of patients having the tether cord surgery
Yeah.
with CCI. And some of the patients had severe CCI, and all of the patients she operated and had the tether cord surgery before CCI got
Worse.
worse, is better after the surgery. Like they got two symptoms, two reliefs, maybe pain, the lower back or something like that, the legs, but they got so much worse from everything. Most of the neurological symptoms
Oh,
were already coming from the CCI and not from tether cord because
yeah.
of such. I was quite on schedule for surgery because I found a person who offered to be a caregiver or to pay for one just for me to have the surgery. I was scheduled for the surgery, and she had one patient that she said it's so the clinical story is so similar to you, and the patient got so much worse after surgery.
What
Uh,
time was that?
October October 2023.
Um, I got my surgery March.
Yes, I was wondering because
Before that, and I mean, I didn't get worse. It's just nothing was coming back. No, I mean, if
but
she
the guy
thinks,
got worse.
yeah, but if she think that, like she never seen anyone worse than your case or whatever, I don't know how she think about my quadripleurosis. At the time at the hospital, I was using those like cop buttons because I can't really do anything with my arm.
She said that is not that is that she thinks is it will like kill the functions of my organs. Like whatever is left is going to stop working because I have a lot of symptoms in the inside
Yeah.
that unless you're a professional like a specialist, you will never know that, or your glucose or your GI symptoms, and people will never relate that, but she
Yeah.
does.
She didn't know at the time that my glucose was so off because I wasn't having a Dexcom, you know.
You didn't have the glucose.
No. Yeah.
No, I knew it, but because my attacks are, I mean, I don't have it's expired, so I don't have it right now, but I have at least five, like half of the days. But it's not just short episodes, but most of the day it's bad.
Yeah.
It can be whole night waking me up with the alarm. Beep, beep, beep. I take the book
Yeah.
up for I think
Yeah.
works for a few minutes, then and I'm like, oh my god.
Yeah. Uh,
So and she said that it was uh, too risky. I've been on oxygen since 2022, and it's 2021 actually, but I've been increasing the dose uh, because it's just not working. If it's less than 6 liters, it doesn't do anything.
yeah.
Like the
Exactly the
pressure.
same. Exactly the same. I was slowly tapering up to 6 liter, and then I think when I talked to someone else, and they're like, I only know someone getting 2 liters. Like I was like, I don't know. Like I just keep like thinking, the stats. Yeah, I don't how it felt, but my even this ventilator didn't really come until end of 2023 when they
Mhm.
have to have someone to believe that this thing is real.
Yes, I mean, sometimes I'm having really bad levels and I don't notice unless I measure the thing. So the doctors, it's hard for them to believe that something's happening. Uh, and sometimes you feel bad before the measures are bad.
Yeah.
But um, I become purple. It's, it's ugly. And right now I use the 6 to 8 liters, sometimes 9. And she knows because I went to the appointment. She made me go, and she sits like she was watching the oxygen machine. The way I walk, the way I move over the chair, when I breathe, like everything. And she was listening to everything. She gave me this report. You can have the surgery before having the CCR surgery first, because I think your symptoms, even for the legs and everything, are not coming from tether cord. Tether cord is causing a lot of pain, and I, it, you already have the damage in your bladder and your gut. I don't think it's going to get better because it's been so long.
Yeah.
But the other symptoms are not coming from that. She made me lie on the table, flat table, to try to polish my legs, my arms, and I couldn't do anything. And I answered, "Oh, but if you put me in this position, I can do it." And
Yeah.
she said,
Yeah.
"Yeah, that's trick." And I was like, "No, I can move my arm if I'm like in this position, turning
That's
my."
right. Yeah. Like
And
this.
I was so sure.
Yeah. Yeah. And if you go back down and then my voice even gets smaller and then
Because
it
you even there's a point where you lose it, and you
mhm.
can't even speak or. And she sees that she even says, "Can't. I mean, this is too risky. You can have the surgery after that, but not that way." And then the problem with the CCI is that the doctor thinks I cannot have the surgery unless um I get on TPN,
Mm.
because I have chronic vomiting more than 30 times per day. I vomit. It's too much, and it's impossible to have a fusion that is going to be at least to 6, 7, at least. With 30 vomits per day, I'm going to break the hardware, and I'm
Mm.
going to break myself. And
Yeah.
so it's also, I don't have a nutrition in my body to recover from the
Yeah.
surgery. Surgery can make me lose more weight and make me weaker because
Yeah.
of it's a normal effect of the surgery. But to have the teeth, and there's no hospital that will give you teeth unless you have a permanent home care. I don't have that. I am living in hotels, Airbnbs, and right now staying in the house of a family that literally rescued me in the air at the airport. I was alone. They went there to rescue me without knowing who I am at all. But this is temporary, and I cannot um, have the home care here. I don't have. I'm not a citizen. I don't have benefits in the whole country. I don't have the Medicaid here. I don't have the home care. It's really complex
Yeah.
to fix it, and we don't know how long it's going to take for the nutrition to make me really stronger, because it's been a lot of years for me vomiting every day. Um, my bones are really fragile. I have osteoporosis. It's really advanced.
Mm.
So there's still chance, but I need to kind of hurry
Yeah.
having a permanent place so I can start with the treatments.
So now are you at this point I think you update me about the last visit. Um so you're able to get the TPN and or s-
I'm not yet, because to get the TPN, you need to have a permanent home and home care.
Yeah.
If you don't have home care, they will not start the TPN, because they need uh, to have you like a nurse going to your home to put the needle or whatever every week at
Yeah.
least. And it's like the place needs to be really clean. It needs to be a place where you don't need to move at all. It needs to be a room
Mm.
like
Yeah.
organized for you, like medically uh, clean, everything perfect, and you need to have the services so you can start. And I don't have that right now. If I go to the hospital, they will treat me either like they will be clear and tell me the truth, because that has happened. I prefer that. Or worse, they will tell me, oh, but you don't need that, because that's also possible.
Yeah. And you said there was a lot of hospital like just kind of send you home at the time. Was that before even you go to see the Petra clinic?
Before and after.
Is it
Before and
after?
after.
Before and after.
Before and after. I have reports from the hospital. Oh, we're so sorry we couldn't offer surgery.
Mm.
Things like that. I mean, my reports are kind of crazy. The discharge reports, it's like you read that and you're like, are you serious? You're saying she needs surgery and you're not giving the surgery. What's the reason?
But you got the insurance. What time did you get the
Now
insurance?
I have the insurance, but the insurance I have is not uh, doesn't cover home care.
Hmm.
I can pay, let's say, for the surgeries if the doctor accept the insurance.
So you got the insurance, and I remember you said think
Right.
about you went back to the Dr. Bolognese.
Yes, it's killing me because I was moving too fast.
Oh, I remember you said you had the ICT, right?
Yeah, I had it 2021
Wow. And
and of 2021.
yeah, so did you actually get symptom relief? How did you feel at
No, after the test, I got worse.
yeah, but before like I mean during the test, how
During the test, oh my god, that test was the best thing ever. The worst and the best. During the test, I got a lot of pain in my lower neck, in my lower back mostly. They put terrifying fun in. I grow, and it was I think 3 inches. It was a lot. I was taller, and at the beginning, with a little weight, the improvement was 20%. I think they put. I was swallowing perfectly with a straw, with a tiny straw, like
yeah,
plastic, normal water. And that I show myself when I do that. I can only do it like in laying down.
yeah,
My side it's really difficult for me. I choke, and I get tired, and I can start doing it, and I leak up all week my muscles on my face. I
hmm,
get really weak, like if I was blowing something. It's the
yeah,
same thing. The breathing, the oxygen, that like every time they were putting more weight, it got better. My vision was so clear that I said, "You gave me drugs, right?" Because I see like too many colors. It's like 5D, and they were laughing at me. Arlen, this is real life. That's life. It's normal. This is a room with a lot of light, because it's a surgery. Like it's a noir. It's normal. But that's if you don't have any drug in your system. It's nothing.
mm,
You have fluids. That's it. And I was no. This is impossible. So different that the way I see. So now I could see that I see very broadly.
yeah,
And the strength to carry. They gave me a bag with 4 pounds
Mm-hmm.
to uh, carry the bag like this and just just
Personally.
yes, you throw the bag. And I was so shocked. Like I never do this. Like not even when I was a kid, I was unable to do this. How is this possible? What's going on? Are you sure you'll never give me drugs? Something's wrong. I was shocked.
Yeah.
Actually, really shocked. No headache, like nothing. Like I felt the relief. Like I don't know, my head was breathing, something like that. I don't know how
Yeah.
to
I
like
think I know how you feel.
because the
Yeah.
rest of the time I am losing the air. And I was feeling, whoa, there's like this air inside.
Oh.
I feel something here. It was so weird. And
So
I
like
felt
your diaphragm feels like your diaphragm that was able to move. Mm.
exactly, I was flowing and breathing really strong. Like they made me blow and before and after they put away. Before I was doing nothing because once you sit me, I do nothing. Like
Yeah.
but when they put all the way, and I was all like late. It was just incredible. My legs were weaker, yes, and I had a lot of pain in my lower back because of the intercom.
Mm-hmm.
But most of the symptoms got better. Most of my symptoms got really, really better.
Yeah.
I stopped having nausea. Like I have nausea all the time. It was gone, gone. I don't feel it. I feel like my stomach is empty. It's weird. How is this happening? When you're
So
empty, yes, but I can feel it. I was
yeah. So did he diagnose you anything? It was like clear what exactly is wrong besides CCI. So like
they diagnosed severe CCI. They diagnosed Ehlers syndrome. Uh, mm, I don't know. They gave me the measurements and the difference. I remember was like I think I had the paper from 40 to 70 something. It was too much the difference um, from uh, with the way without the way. There's something they call the rebound of the symptoms when they take off
yeah.
the yes the halo. They
Yeah.
take the halo. I had no idea before I got the test, but when they took it, they took all the way and like the head, like you still have connected the tubes in your brain, but you don't have any way. Like I was sitting straight and steady, and I
Mm.
fall down like an accordion, and they say, "Oh, it's a human accordion." That's what they loud, and I was like, "It's not funny. Put the way back." And they were like, "No, the test is finished. It's not like I don't know, like something you asked for. We were doing a test, that's all." And they was like, "No, please put it back, put it back." I was unable to like this, moving
Yeah.
like this, and unable to sit at all. They had to lay me down and take the rest of the stuff laying down
Mm.
because I was literally melting
Yeah.
and I had no color.
Oh. They didn't put a
And
collar back on, or you haven't really had a collar.
yeah, no, they put it back and in the bed. But when I had the whole test was without a color.
Yeah. Oh.
The
I
test is without a color, but your neck broke.
Yeah, I thought they would
And,
put the collar back on, then release the weight.
they should. So, but I think they need to see the change. I guess. I mean, I don't know. But I
Mm.
think that was so cruel. I felt so bad. I was like, please put the weight back. No, we can't do that.
It's like, yeah, I literally had people question, why do they just do the test if they know that you are positive for everything and then they don't really do anything afterwards? You know what I mean? Like,
No, yes.
yeah.
Yes, and it's not just for me. I mean, so many people get the test and they never had surgery. Some people get the surgery immediately. The very, very lucky ones get the surgery.
I was actually worried about that. That's why I didn't go through the January. I already scheduled January 4th for the ICT. But Dr. Henderson was like, you already know you're so pathologically like so wrong. Like, why wouldn't you need like a test to tell you? And that's what he said. But I feel like I wouldn't be able to recover. That's the kind of feeling after like they put back, and then I will be like in the OR. I will not have a choice but being like stabbed all the way down. You know what I mean? Like, uh, I don't know. It might be a good
There's,
tool. Yes.
I think that it's good, but I'm not sure if it's right if you're not doing the surgery immediately, because I think they can even stretch your tissues. I grow about 3 inches. I mean, they can. I don't know what they did, but I went out of the test and I became weaker permanently after
Oh,
that test. I never got better after the test because I
yeah.
never got surgery, but I became weaker. So I'm not sure if something
Like
specifically happened.
like instantly after the surgery. I mean, after the surgery means after the test. Um, yeah, this is something I feel very hesitant because the community, usually on Facebook, if you see about CCI and stuff, I'm not going to talk specifically about it, but they do have a lot of people um, really prone on this kind of test. And they think that there's nothing going to happen. I even got so encouraged with someone who already had some hardware in and did the test. And they end up being, they said, oh, it's just some rebound symptoms and it got better. It's fine. But I feel like it was not. In my case, I can just imagine that it would be really bad. Like what you said, weaker, or in a sense, like it's too much rebound symptoms.
I don't know if it's just, I mean, the rebound is supposed to last a few minutes and then you get better. But right now I have problems even getting the upright, because when you try to do the upright, I start moving my head, I immediately start trembling of my
Mhm.
body. So they can take any picture actually. So I have to crunch, like do like this to get, it's not the right upright like I used to do before.
Yeah.
Like I was doing the uprights before the test and it was painful and exhausting, but I was able to do it. Now it's I that my whole body trembles when you try to bend my neck.
Mm.
So I'm
Yeah.
not sure if the tissues are different. And I I never went off the oxygen. I mean, there are so many things that change, and I'm not sure how much is related to just the progress of the disease or the test. But I really immediately got worse in the same day. My mom was really scared because I was like like I was fainting, nonstop fainting for 3 days after the test. But no, it's she's gonna get better. I got better from that, but not the rest of the symptoms.
Yeah.
So they should only do that if they are doing surgery, I think, because if you are doing surgery, you are holding the tissue, so the tissue will not get stretched, because this literally stretch you a
Yeah.
lot.
I
But
don't, yeah, I don't understand why they have to stretch that far to see the improvement, to see it. I mean, of course, for you to also feel it, right? But they're like, oh, that's like you try it out. But no, that's like you pulling the tissue, stretched it, and they're not gonna go back to the normal. Like, like once if you I don't know if you had that kind of the mouth surgery, you also had a like hypertrophic ligament, or
yes,
those ligaments get stretched and they fail or something, and they don't go back. So that's kind
mhm,
of what I
they
think
never
that.
go back. Yes.
Yeah, I think that you're right, like about those soft tissues, that everything got stretched out.
So
Yeah.
if you hold it in, like hardware, we hold it and you somehow uh, can't, like the tissue can stay steady, but if you are not holding the tissue is just, we
Mhm.
are so weak, fragile.
Mhm.
So I never got it, and I do know patients with experiences like this. Like I got so much worse. I'm not getting an ECT again. It's so strong, and then there are others that say, "Why do I need to get another one if I got one last year? This is a really bad test. I don't want it." Uh, so I don't consider that, but there has to be a reason no one else is doing the test.
Mhm. Well, the only thing is just for them to do upright MRI, right? Flexion
Yes,
extension, and then to see, so they have measurements. So they're using the measurements to say, oh, you're already pathological. Yeah, don't don't need to stretch your.
and the clinical testing and the,
Yeah.
like,
Yeah, I actually, that's the one thing that I think Dr. Henderson didn't understand why they have to do that again. And also I received emails about, oh, you can always find other surgeons. They will do this. They will do the surgery without the test. But then he promotes it in a way that I saw that in an interview, and then they proudly talked about the questionnaire, the like a really long questionnaire, and then they also proudly thinking that, if you don't take the test, right? I just don't know, like maybe you're not sick enough. I was like, so why? Like, like us, or seems like you're scared of, like, that the result is not, you know, good enough for them to say that I offer you surgery. That actually made me feel like I wanted to take the test. I feel like, don't want people doubt you. I don't know how you first found with Dr. Bolognese. I know somewhere else is doing the test as well, Barcelona, if I'm right.
yes, but that's, he's copying Dr. Bolognese, and he started this year.
Yeah.
He's copying Dr. Bolognese. So Dr. Bolognese created it as the copy that's happening in Barcelona. I don't know how exact is the copy. I'm not sure. I think that doctor is, from the patient's experiences, the doctor is way different than Dr. Bolognese. That the doctor is really kind and uh, compassionate. I don't know how's the difference with the testing. I will have to ask
Yeah.
patient about the testing.
Oh, so you don't think that he is really that caring?
That maybe he's doing the test, but I don't think he's uh, like I was saying. I can't move my legs, or I can still move my legs, not a lot, but And during the test, I was unable to do it. When I say that, they still put more weight. And they say, let's see if you get more improvement of the symptoms. You are having improvement with more weight. And I do. I did got better from those symptoms. I was having really bad symptoms on my legs and my lower back. The pain was horrific.
Yeah.
They were stretching my whole spine.
Yeah.
So that
That's
I don't know
that's
what.
kind of, I think that's why I lost my hip movement, you know. I was free climbing. They kind of just strapped you a little bit, right? And then I just kind of like trying to grab the next, like that time I still have all the movements on my upper half. And then you just kind of like trying to grab another thing, but then your whole body is sort of just like stretched, like, with gravity.
Yeah.
And then the same day, like evening when I got home, and then the second day, it just suddenly, like within 24 hours, bam, it's like my hips gone, you know? So I think what you said is exactly makes sense. It's like the whole entire spinal cord is being pulled up, and if lower is tethered. Yeah.
Yes, and if you know the patient has tether cord, I think it's even worse doing that.
Yeah.
It's dangerous. The dangerous. I, I like the response you can get. Like you can get a really like you can know exactly how the surgery will be. Maybe that reduces the time in the surgery. I don't know, but the bad part is that I don't agree on that.
Yeah.
They knew I had tether. They I
I,
was
I
already diagnosed. I don't know.
yeah, I think it's actually a very interesting point. As you know, a lot of patients experience a lot of gaslighting from doctors doesn't know anything about EDS or these kind of issues. But I think it's just in general thinking that, oh yeah, they're just human. They don't really, they want to do one good thing, but then they might mess up the other. And it's hard.
Exactly. We need doctors kind of picture the whole patient and the life of the patient. Like ask the patient what kind of problems they have. Also, you don't know what's going to happen later. Do they have a way to rest after the test? Or is
Hmm.
it going to be okay? Like they can go back to the hospital. I was unable to do it because without insurance, the hospital would never take me back. At that time, I didn't have insurance. And the hospital put out like a rule that I cannot go to the hospital unless I
Uh,
have insurance. But I had like my residence came after that.
mm,
So it is it's cruel and it's happening to so many patients. Every story is different, but it's cruel for so many.
yeah, yeah, that's
So
true. I think
uh,
that follow
I think
up.
it's needed if you're if
Yes, yes, go ahead.
yes,
Um, I was
not to
just,
keep the
yeah, yeah, yeah. I was just thinking, like, that's so true. Like with them not really having enough of like after follow up, because so many patients didn't really have the surgery or didn't have surgery with him. And I think that it still kind of needs, even like from the scientific point, right? They need to know like how they respond to the rebound symptoms and all that. And yeah, I think it's really wise to actually conduct the studies through the follow up as well. Even they don't do surgery.
yeah.
Yeah. So that's 2021. Um, Now you finally, like, are waiting for getting TPN so you can actually have the surgery.
I think with the TPN I can have the surgery. I mean, I don't think it's um I don't think they're gonna put more. problems then after that, but I agree on that. I cannot have the surgery having 30 to 50 vomits per day. It's really dangerous.
Yeah.
It's
Well,
projected vomits. It's not just,
yeah. Is it just hoping that the fusion is gonna actually stop the vomiting?
we don't know exactly how much is the fusion able to help because we don't know how much of the symptoms, how many, what's the amount of, uh, how much the CCI is really causing the vomits, or is it because of the vascular compression? We're not exactly sure how much is uh, everything, but the doctors think that the spine is worse, the central nervous system failing is worse. My dysautonomia is too bad. It's my life. I have symptoms of brainstem compressions 24/7. I don't have symptoms of vascular compressions like I have from this. So maybe yes, maybe it's gonna help a lot or stop them.
Yeah. So it's the fact that I think people don't understand about brainstem compression that much. Um, right? And the fact that people they always say, "Oh yeah, so traumatic brain injury was brainstem, and then these people just die." But we are alive right here, and then we're dealing with the aftermath of things, or still dealing with this whole entire issues. Um, yeah, so but it's still kind of hopeful though.
Yes.
Is your uh was your mom gonna come?
My mom, we don't know if she gets the visa, she can come. If she comes, it's like the process of getting a permanent house. Like I don't have financial resources. That's my biggest problem because otherwise I would just rent a place and or purchase a home and stay there and
Yeah.
have all the treatments. That would be actually the property. But as I don't have that, it has to be if she gets to come, we need to find a affordable apartment that gets city voucher that accepts that city voucher,
Mhm.
so we can have the home and get the home care approved again because I used to have it, but I never got the home care to start because I don't have a home. Like it was approved, but they were like, okay, where's the home? There's no home.
That's true. Yeah, so hopefully at least you like can get a place to stay that get more stable, right? And then you can have the surgery. That's the best outcome of this. Um when you're thinking about all these doctors, do you have one that in mind that you feel like you're most thankful for?
Where Franco Mann. I mean, she never did a surgery or a specific treatment, but she's the doctor that's always there to connect the dots, to think in the whole picture, to listen to all of my symptoms, even when they're not happening in the same minute. But like I can tell her who I was having symptoms before, uh, and she believes and she listens and she understands because she
Mhm.
has 45 years of experience and she tries to connect me with doctors too,
Mm,
with other doctors. So it's I think she's one of the most kind and compassionate persons I've ever met. Honestly, she's amazing. She's amazing.
yeah. So like I feel like that comes with experience too, right? So they know. And um so is she almost like your resources? Like, the way that you get all the doctors and the right people to go to and Yeah. Well, that's amazing.
Yes, there. I mean, I have never seen a patient say anything wrong about her. I guess it's an amazing person, not just an amazing doctor. She's still a person at the same time of being a doctor, and that doesn't happen most of the time.
Yeah.
So it's really really good, a good person. She even said, "I wish I could do all the treatments. I mean, I can't because I'm not legally. I I cannot do it, but it's amazing, honestly."
Hmm. What is one thing that you feel like it's quite different than where you from, or like where you from actually?
Well, yeah, there is no doctor where I live. There is not even the medications I take. They don't even exist in my country, Venezuela. But uh, many of the doctors are doctors willing to research, to read, to even things you can send to them, like you send them, please research about this, and they will do it. Try to understand and help you and say, well, that's going to help me to help other patients. That's easier to find that
Yeah.
here. Like they are, it's more common there than here. Here, doctors are, most of the doctors are too busy to do anything, to even listen to a patient. They have 5 minutes, 20 minutes, that's all. Doctors there, they will give you hours of appointments, extra appointments. Um, they will give a little bit more. So it's more compassion, but like they are more compassionate, but as like there's no resources, there's no machines, there's no doctor knowing about this.
Yeah.
Fortunately, I cannot use that. It doesn't work anymore for me.
Yeah.
But that's something that, and they truly try to understand. So it's not only because they want to make you feel better, but because they want to help
Mm.
in a scientific way too. So it's
Yeah.
that's what I miss here. The doctors are too far from each other. Many of them don't even communicate each other. But at least we have the doctors. At least we have the medications. At least we have the machines. We have the surgeries.
Yeah.
They exist. It's really hard. It's very expensive, but it exists. It exists.
Yeah.
You go to another country and you get care for one, two diseases. If you have 15, you would die. And
Mm.
what are you going to do? There's no coverage for the medications I take outside, so you have to pay for them thousands of dollars every month just for the medication. You
Wow.
never get access. The doctors are out of pocket. All of the few doctors you can find are out of pocket. It's it's a really difficult country, but it's the only country that at least offers something. Uh, it's just it should be more affordable.
Yeah. That's yeah, that's so unfortunate. But I feel like, I to me, it just reminds me of like some of my home experiences. Like the doctors sometimes don't really know, but yeah, I feel like at least they are compassionate enough. That's why the first thing when you talked about, like, when you start having these things, issues, and I was very surprised because they did not um have the machine for your spinal cord stuff, and then, or they said that they don't have the right machine. I was like, wow. They will listen to it and they will think that, well, you really have a problem that needed to take care of it. I definitely appreciate those a lot. I feel like they need to have some of a mixed ground. People like doctors here have a little more time for each complex patient. Yeah.
They should
Oh,
learn from each other, maybe.
yeah. So, well, I really appreciate like this is not our first time had the conversation, and I just feel like the first time we talked, and it was really great to you know see how almost feel like it just seems like how smart you also are, like with all these conditions that and the understanding of it. And I mean, of course, we become our own doctor after a while. Yeah.
Yes.
So
No, thank you. You're amazing. This is an amazing project. I mean, really overwhelming. I mean, in a good way.
okay.
I'm
Yeah.
really glad.
I really hope that I can make some change in some way. So that's why we start from here, right? And we know no, we don't really end with what just the podcast, but yeah, we start from the small little steps, and people hear you guys and hear a group of voice, and so that gets stronger than our each individuals. Um, yeah, and I really hope that you can get some good care, and you know and hopefully this is gonna be like the start point of getting better. So any last thoughts that you want to share with the listener?
Um, I haven't seen. Well, there are a lot of stories still to listen in the podcast, and from my side, I there's one of the conditions I have myalgic encephalomyelitis and ME. Um, Not sure how many people you know, because I think with CCI, with Tether it's very common. So I, what I know is 31% of Ehlers-Danlos patients, but how many of the spinal cord patients, maybe it's percentage is more.
Mm.
I'm not sure, but I think it's interesting to speak about this and not make a topic or, because I consider when you get ME, but Ehlers-Danlos is different than when you don't have Ehlers-Danlos. And the hope that we have is that the ME gets better with the treatments for Ehlers-Danlos. Like the Ehlers-Danlos is causing the
Mm.
mainly. I got the symptoms after the infection when I was 5, but I was diagnosed when I was an adult. So we didn't know, but I had the symptoms. Uh, but I think I would like to know if there are stories about that. Maybe no one is mentioning that, but they do have any. I don't know. I think we need to speak more about that because it's part of the problems. Uh, and there's no treatment. There's no specific treatment right now.
Mm.
And but how much can we improve with the treatments for Ehlers-Danlos at least? And what else? If I share my story, and I will try to share my story until my last breath, because I think uh, it helps to bring awareness about not only my story, but people see my story, they will think about other stories. And there will be some people saying, oh, I will dare to share my story now because she's doing it.
Mhm.
If that happens, or that's for me, that's everything. That's the reason why I share my story. I want to uh, bring awareness and to make others, to encourage others to also tell their stories. because I don't think their story of just reading a paper in the medical record is enough. We need the story, person telling the story. That's it. And if I get better from these surgeries, I plan to make a foundation to help patients with expenses because the traveling is so expensive. All of the patients have some financial problems, but to get the surgeries, to get the treatments, to even get diagnosis sometimes. So I'm hoping to help to that way. Yeah. And thank you so much for all the work you're doing. It's amazing.
And yeah, thank you so much for the last words. It's like so important because I also kind of missed the day of May 12th, I believe. That's like ME Awareness Day. I actually wanted to share a few posts and even reel. I think maybe like while sharing your story, we can also share some of theirs and hoping that bring more people with the ME community to hear. And this is why I call it an occult. I don't really call it any kind of CCI or something like that. I do believe that there are so many misdiagnosed or undiagnosed cases with all spectrums of diseases that don't get treatment early on, and then it's like become more difficult to get treatment or even get improvement. So yeah, thank you so much. And this is really important, I think. And by the way, like if you want to do a foundation, like join us, and because we are starting wanting to build one. Mhm.
Yes, that would be great.
Yeah.
Hopefully.
Yes. So that's why this is part of it. We want to share the stories, and we want to then connect people with the right media resource for more people to listen in and hear us.
Yes.
Yeah. Yes. Thank you so much for joining us on the show, and then like talked all these amazing things about the awareness and your knowledge about the whole entire conditions and comorbidities. If you or someone you know is navigating similar challenges, remember that support and understanding are out there. Our podcasts aim to offer hope and understanding, share knowledge for bridging the gap between patients and the broader medical community. Don't forget to subscribe to Occult Awareness for more powerful stories and expert discussions. I'm finally done with traveling for a while, so we will get back on track for the following episodes with more stories about occult conditions. Please share this episode to help raise awareness and foster a more compassionate and informed society. Until next time, stay strong and stay informed.